Hello everyone, welcome back. So in today's topic, we're going to talk about burn. So if you remember in our chapter of human body system, we actually talk about human body has all kinds of different systems, including digestive system, which include your stomach and intestine, and cardiovascular system, which include all your heart and your blood vessel and all that. And if you remember, we also talk about the integumentary system, which include your skin, and that has a lot to do with today's topic, which is burn. Burning is actually most of time burning your skin, because skin is your immediate outlayer that protect you from say a bacteria infection and all that. But burn is direct or indirect high heat cause damage to your skin organ, and that's what happened. So with no further ado, let's delve into today's topic. So today there are four topics we want to talk about. To begin with, I would like to talk to you about statistics. So how many people in the world in a year sustain a burning damage, and what is skin? We will talk about a little bit detail about what makes skin organ, and then we're going to talk about what type of the burning and what kind of complication can be caused by burning. And then the fourth, the last, which is also the most important things for all the practitioners in the rehab field, is the treatment and rehab plan. So to begin with, the statistics, there are 500,000 burnings per year. As you can see, that's a lot of people. And burning can come into many different forms. Direct fire burn, and it can be sunburn, it can radiation burn. So many kinds of different format of burning, and that costs that many people. And you can see that 40,000 are hospitalized each year, with 25,000 to specialty burn treatment center. That means a lot of burden to the hospital. So some hospital know that it's so urgent in a way that they need to create a center just to deal with this, because burning, the care of burning is very different from trauma. So it requires very special care. 4,000 deaths because of burn trauma, and only 10% of admission had more than 30% of body surface area damage, and which we sometimes call TBSA, and we will cover that in a minute. And 70% are males, and 35% are children. Children is easier to understand, because children sometimes they might misuse something, and they might get too close to the kitchen, which they shouldn't, and they didn't realize that kitchen can be dangerous. So sometimes kids got burned more often than the adult. Now the question for you guys is, why do you think males are more likely to sustain burning damage than female? So let's put that question in our discussion board for you to answer. In terms of age of group, who's in high risk of sustaining and burning damage is around 20 to 30 years of age, and that's probably quite intuitive as well, because young people sometimes like to risk themselves and probably get involved in things that's more dangerous. So that's probably one of the reasons why people who's around 20 to 30 years of age probably more likely to sustain a burning damage. The home present the highest risk area for thermal burns at all ages. So home obviously meaning kitchen, I think, because sometimes we know that home is so convenient for us and we feel so comfortable with it. So sometimes we just overlook all the potential dangerous stuff in, and 75% of the burns are preventable. I think that's something we need to work on to avoid it. And 40 to 39% are related to abuse or neglect. That's obviously pertains to all the children. Physiology of the skin. Skin is the largest organ. As I just mentioned earlier, skin is actually within the integumentary system, and it's one of the biggest, not one of the biggest, it's the biggest organ in our human body. And if you spread out the human skin, it's actually 2 square yards in adult male. And the functions of the skin, including protective cover to all underlying structure, protect against infection, like I just say, bacteria, and pretend loss of body fluid. If you think about sweating, and also protect the water from vaporize to the air, that also control the temperature of our human body, and also sometimes again sweating to lower down the human body's temperature and receive sensory stimuli. So for example, somebody pinch you, you'll know that because we have the nerves underneath the skin, and that will send the message to your brain that something has happened. And also produce vitamin D. If we direct expose ourselves under the sun, our skin will start to produce vitamin D, which is needed in combined with the calcium that will help you, and also determine your identity. For example, your face, the way your face look like, it's part of the skin's job as well. So this is a picture to show you the skin, and I want to point out on your left hand side, there are 3 layers: epidermis, dermis, and the last one is subcutaneous tissue. Subcutaneous is mostly fat tissue to protect you, and the real skin is the outer layer, which is epidermis and dermis. So 3 layers: epidermis, the thin outer layer, and consists of densely packed epithelial cells, and dermis is inner portion, consists of mostly connective tissue, including your blood vessel, nerves, hair follicles, sweat glands, and others. And if epidermis is lost, dermis can rebuild epidermis. So meaning that if you just have a minor burn to your outer layer skin, your dermis can rebuild it. However, anything go deeper, it's not possible to fix it. In other words, it's non-reversible. Subcutaneous layer is the very inner layer, which contain a lot of connective tissue, including fat, and that connect to your muscle, tendon, and bone. Tissue injury caused by, there are different types of burning. For example, the thermal burn, that is probably the most common, so you direct contact with the fire or cold. For those of you who live in California all your life, you probably don't know cold can also burn you. If you directly in contact with the cold, say you put the ice on your skin for too long, you also sustain a burning damage. And it's just the way we call it. It's basically the damage to your skin. It's not necessarily burning, because you would feel that burning is pertains to fire or heat damage to your skin, but that's just the way we call it. You can basically call it a damage to your skin. That's why cold can do damage to your skin as well. Electrical burning, it's a very special type of burning. The electrical things is that, for example, if there's a person got struck by the lightning, then that's an electrical burning. And there are some chemical burning too. For example, if you are in direct contact with the sulfuric acid, you're sustaining a burning damage as well, because sulfuric acid will take away all the fluid from your skin and then sustain a burn damage to your skin organ. And there are some radioactive things that can cause burning too. So in terms of seriousness of the burning damage, really depends on here the type of burning, the intensity of the agent. That means what kind of burning, and the duration of time the tissue exposed to the burning, and the part of the body involved. So for example, if you just burn your arm, it's probably not as serious as you burn your chest. Temperature greater than 113 degree Fahrenheit can produce burning. However, it can be much lower, but still burning your skin. For example, if you are under the sun for too long, you sustain a burning damage. But as you can see, the sun is rarely get to 113 degree Fahrenheit. It's probably much lower, but it can still sustain a burn damage to your skin organ. So to classify the burn damage, it really has to do with the depth and the width. So the depth is how deep this burning damage caused to your skin organ. So again, outer layer, epidermis, and then dermis, subcutaneous. Which layer does it burn to, and also the area. So we just talked about TBSA earlier. It has to do with the area of your body, your skin, which was caused by the burning damage. So in terms of the depth, there are four degree. First degree only cause damage to epidermis, so it's very superficial. The second degree, epidermis and partial dermis. Third degree, epidermis, dermis, and all the skin appendages. And then the fourth has to do with burning to the very deep. And usually what happens for this fourth degree is that usually is only caused by electrical shock, because the heat doesn't go into that deep unless it's burning everything. But electrical shock just one time can burn through all your skin layers to the very deep. So usually what happens for the fourth degree burning usually is caused by electrical shock. So this is another picture to show you the different degrees of burning. So in terms of first degree or superficial burning, is a typical sunburn. So just like sunburn only burn the outside, you'll feel itchy, you'll feel red and painful, sometimes dry, sometimes you might see you started to grow some rashes and all that. And usually you don't have to do much. I know that some people like to put ice on it, but usually you don't have to do anything and your skin will just repair itself. And again, if your outer layer epidermis is damaged, your dermis can help to rebuild it. The second degree, so you will see red and bright pink. As you can see on the right hand side, there's a picture of the second degree burning, and usually started to have some sort of moist. And the reason for that is our body started to push the fluid out to separate the burning damage from the good skin tissue underneath. and it's very painful, secondary to exposed to nerve ending. So because of the burning, the damage to the epidermis and to the dermis section, the dermis section contains a lot of nervous system, and because of that you'll feel extra painful if it's second degree. The sensation is probably intact, and usually what happens is the heal will be within 2 weeks. Mottled red or waxy white, as you can see on the right hand side, there's a picture of it, and it's a little bit wet looking, but it's just the looking, it's not really wet. And wound is soft and elastic, and basically the fire or the burning changed the component of the skin, and that's why you see the different color and become elastic. It's not a real texture of our human skin. And it may also affect your hair follicles and sweat glands, so you might not be sweating that area anymore. And sensation really varies, depends on whether you damaged the nerves already. So the previous slide is actually still second degree burning. It's just it's deeper, and now it's a third degree, or what we call full thickness. So it's white and tan, waxy, and sometimes our vein, our blood vessel is affected because of the burning, and because of the burning that might close your blood vessel, and that affect your circulation, and it'll be dry and leathery texture. So it's not a living organ anymore. It may be dead. Your skin organ may be dead. Initially painless because your nerve is completely gone, but it depends. And most of the time, if this is the case, you require some grafting because there is no dermis left anymore, and since your dermis is not there, it cannot regenerate your epidermis anymore. And you may be wondering, why do you need to have skin? Because if you don't have dermis to rebuild your outer layer skin, which is epidermis, you are susceptible to all the infection from outside. So that's why sometimes doctor will suggest you to have a skin grafting, so that this area of the body can still be covered by your skin to protect you. The fourth degree burning, and again, is usually caused by electrical burning. So electrical shot, because of electrical shot, is go through your body, and usually that sustain the deepest damage. So we just covered the depth of the damage, and which is how deep the burning caused to your skin and other the body area. Now we want to talk about the area. How wide, how big the burning is. There's a rule of 9. For adult, head and neck account for 9%. And each hand and arm is 9%. So your left arm, left hand, 9%. Right hand, right arm, 9%. Account for 18%. And your foot and leg, think about this. Your foot and leg is much longer than your arms. So it account for the double the percentage, which is for your right leg 18%, for your left leg 18%, account for 36%. And then is your chest and your back account for 18% each, account for 36% in total. And then is your reproduction organ, which account for 1%. So add up, it's 100%. That's how we report in terms of TBSA burning area. So you might see people sustaining a 90% burning. That's actually how they calculate it. And next slide here, you will see that kids has a very different way to calculate it than men or adult. In terms of kid, you can see that they have shorter leg, so they counted as 14% each. But their head is much bigger than, in terms of ratio, it's bigger than what we have in adult. So the head count for 18% for kid, and the legs and foot count for 14% each. So in terms of minor burn, 15% TBSA for adult and 10% TBSA for a child. So I won't read through all these, but you'll see that for adult and for the kid, it may have very different way to calculate it. Some of the complication, meaning that it's probably not direct caused by the burning, but something after burning. So contracture, say your skin is not as elastic as it used to be, that will cause some problem in terms of the function for the person. And hypertrophic scars. You will see some scars from burning, and sometimes the patient of burning damage may have some itchy skin, which we call pruritus, and eye injuries, loss of facial membrane, and hair loss. I don't know whether I shared this with you in the past, but most of the time when there's a fire hazard happen, most of people who die from the fire is actually killed by the smoke as opposed to the fire. So if it's thermal burning, sometimes come with smoke inhalation, and that causes a lot of death. And even if it's not, the person is not dead, the lung damage by the smoke probably is more serious than the burning itself. And other complications including sepsis, which is infection goes into the blood, and also some weight loss or some other infection as well. The rehabilitation potential, long-term prognosis is good. If the person is following through the rehabilitation plan, most of patient can be back to work or back to the school. 85% of the patients return to gainful occupation within 6 months of hospital discharge. So that means the prognosis is actually pretty good. And there are some treatment. For number one, acute care management, that's right after the burning. So medical care, positioning, splinting, and wound closure, and pain management. So once it's past the acute treatment, the rest is really the care, continuing care, and also to do the rehab. So first and for the most, I think pain management is the biggest thing. Without drugs or medicine to control the pain, sometimes it's just simply too painful for the person to do rehab exercises. So pain management is the first, and then it's scar, and then gradually the rehab practitioner might incorporate some exercise to strengthen the muscle, and for two is to make the skin more flexible and adapt to the exercise. Otherwise, because of the contracture, sometimes the person might lose the strength or lose ability to do some function because of the skin being more hardened because of the burning. So next, the superficial burning usually heals spontaneously within 2 weeks, and we talk about this. Probably little to no treatment needed in order to promote the healing. However, if it's greater than 3 weeks, they might leave a scar to the tissue, and it won't go away, so the scar will always be there. And then skin grafting usually is required when it's over 3 weeks of healing time. And again, skin grafting usually happen to a patient who's experienced or suffer from at least third degree burning in terms of deafness. And at this point, the skin grafting is not necessarily for cosmetic purpose, but also for the protecting the human body from infection as well. And sometimes it requires multiple surgeries, and because of the surgery, that greatly reduce the healing time. Sometimes if you don't do the surgery, the healing time might prolong, and that will have more complication as well. So in terms of what is skin grafting, I would say at this point on, I will be showing some pictures, and just so you know, viewers' discretion is advised. If you don't feel comfortable with the picture, just skip it, but I would encourage you to take a look at it and see what's going on. So in the future, if you are helping client with burning damage or burning experience, you know what to expect, and you know how to advise or suggest your client how to do the rehab. So in the operation room, the burning tissue is debrided, and they will typically pick another site. When we say site, basically it's another place in your body, and the doctor will peel the skin off from that donor site and then put it on the injured site. And usually what happened to the donor site, where is your healthy skin is, usually that is sustaining another burning, because basically you just peel the skin off. So here's the picture. So on your upper left, there is a skin grafting. You can see that the doctor is trying to peel the skin, and you can see on the upper right hand side, that's a clean sheet of the skin. This is a picture of the skin, and it looks rather clear in a way, and you can see that is from the donor side, and then put on the injured side, which is the leg in this case, and you can see the bottom pictures. So skin grafting are either mesh or sheet graft. So really there are two different ways to do skin grafting, and it really depends on the area and where the injured site is, and also whether the area is too big. If the wounded area is too big, simply you cannot find a donor site skin that is big enough to cover, they will use the machine to create the mesh graft. Basically is really creating a sort of like a fishnet kind of thing. So with only very small sheet of skin, you can expand it to cover larger area, and because our tissue will cover the holes up gradually itself. So actually you don't need that big of a sheet of skin to cover that big of the wounded area. However, there are some downside of the mesh graft. For one is what they call alligator skin, because cosmetically it doesn't look as well, because you will leave a scar like a fish net. And also it tend to contract more, because as you can see, like a fish net, every tissue is trying to pulling each other together, so there will be more contracture, and that's why after the skin grafting, the mesh graft take a long time and takes really serious care to make sure that it's alright. On the other hand, if the wounded area is not as big, there's a sheet graft. So basically, it's a very similar, very simple way is just to try to find the skin and then cover it up to the wounded area. And this is more cosmetically appealing and shrink less compared to mesh. So here's a question that I for you, but I basically answered myself. How do we decide to choose sheet or mesh graft? Basically, size of the wound, cosmetic concern. So, for example, if it's really like your face, the patient's face, then probably the doctor won't suggest for using the mesh because cosmetically it's not as good, and also the functional concern. So, say if it's right at the area where your joint is. Because mesh contract more, that will affect your arms or elbows. For example, if the joint is at your elbow area, then that contractual issue will affect the functional limitation too. So it really depends on these three things to see what kind of skin graft you need to use. But obviously, the most priority is the size of the wound. And this just another picture to show you what mesh graft is. So you can see that it's sort of like a fish net, and what happened is our body will try to patch up all the holes, but as you can see, it'll be not as cosmetically appealing than the sheet grafting. Here is a real life case example. So you can see that there are 5 pictures here, A, B, C, D, E. If you are looking at the C compared to D, C, that's the same skin, and after using the machine to make it a mesh, actually D and C, that's the same skin, but you can see that D cover the bigger area. That's why we use the mesh. Split thickness. So donor site taken to partial dermis. So you might think that sometimes we don't need the whole dermis, we just need epidermis, but it depends on the situation. And full thickness, small area of donor site, full layers of skin is taken. So basically, you take the whole thing, dermis and epidermis. So besides the wounded area that we try to cover up so that the person will not be susceptible to infection, there's another issue or concerns that patients with burning damage has is the scar. And in this case, in the burning case, it's called hypertrophic scar. Basically, it's all the tissue is exposed or rather visible in a way, and also the tissue organization is different from the original. That's why it started to have scar, and we will get into why the scar exists or happen in a minute. But here's the thing. Early post-healing or post-burning usually is very flat and smooth. However, this scar will start to develop after 3 months. And as wounded heal, new connective tissue is produced, and that's why some blood vessel is visible, some scar, some tissue is thicker than the other, because when we heal, it's hard to tell our body that in what kind of order or what kind of organization that you should heal. And our tissue just try to do as fast as it can to heal. So sometimes because of the sequence, because of the speed of different healing timing, we start to have this scar. And to talk about hypertrophic scar, we need to talk about collagen. Collagen is a protein that contains in our connective tissue, and at the beginning, the collagen is really lined up well and perfectly, one by one, one next to each other. So you see very smooth skin. So normal skin is collagen aligned straight. The scar tissue is that when you burn yourself and the skin tissue or connective tissue is not is being damaged, and that's why when it healed, the collagen started to try to as fast as it can to heal itself, and sometimes it just don't line up perfectly as it was, and that's why you are seeing lots of scar. So in terms of the scar developing process, it takes around 12 to 18 months in order to be more stabilized. So that, in other words, post burning injury, around 1.5 years, you will start to have more stabilized looking, and that's the time when whether it's cosmetic surgery or plastic surgery can be applied because it's more stabilizing. And at this point, during this time, the scar management is the most important thing, whether it's post burning injury or post skin grafting. And the maturity usually occur 2 years post burning in order to see a more stable color and stable tissue. The treatment typically it's really pressure. So as you can see from previous slide, we talked about collagen that started try to heal as fast as it can. So our human body is trying to take whatever it can. So it just started to grow to a direction where it's most convenient. And what happened is, if you consistently apply pressure, there's only one direction that this collagen can grow, and that will help with the scar management as well. So that's why you have seen some burning patient wearing the pressure garment, and we will show you that in a minute. So pressure also often give relief from itching, because when the collagen is started to grow or develop, the scars started to develop, the patient will experience some itching, and sometimes the pressure garment can help as well. So this is just a picture of what pressure garment look like, and these are for kid and these are for adult. And there are, interestingly, with our technology more and more advanced, people start to try to find a way to make new skin. So they are thinking if they can pull your DNA and try to make an artificial skin that fits your DNA, maybe you have less rejection and also it looks much better. So that's what they are doing right now. If you guys are interested actually with the new technology that we have, there are scientists started to look into how do we use the sort of like a 3D printer, but this is not printed with the plastic stuff. This is really printed with the skin. And once we have that technology, these type of things like skin grafting and try to find a place cosmetically, the surgery will be much smoother and help a lot of patients. But this is ongoing. So reconstruction, the burn reconstruction can be a long time, and sometimes it's really demoralizing because it's to some patient is really painful. When you think of the skin is trying to pull you and have all these contracture issue, it's so hard to convince the patient or the client to continue the rehab exercise. Some medical implication. The maturation of scar tissue can have a tremendous impact functionally and psychologically. Think about this. If you are a person or patient with burning injury, people sometimes out there will stare at you or say if you are going up you are going out and apply for a job during the interview, do you explain or do you not explain what's going on? Obviously, if you don't explain what's going on, people will just guess, and we don't want that. However, does the patient or the client has the courage to explain the situation, or when they talk about that story, will they have a flashback of what happened during that time? So it has always been a challenge for the client too. And other things like because of the new skin or the injured site, those skin probably is not as resistant to the temperature change, to the pressure change as our original skin. So things like that are things that need to be taken into consideration too. Functional implication, sometimes because of the contracture things, the contracture from the recovery skin, it's hard to do anything. And there are things out there that can help right now, for example, like assistive technology. So very simple as a crouches or a cane, or even if you have seen that the long stick, that the grabber that can help people to grab things on the floor, that will help too. And I have seen other things like the dish. When you are eating with the dish, there's a dish guard that can help people with lower agility or finger dexterity to feed themselves as well. So there are more and more assistive technology being invented, being created, being developed. So that helps too. Like psychological or emotional implication, obviously we just talk about the shock, the depression, and also when you think about the PTSD, post-traumatic stress disorder, it also affects the person to deal with the daily life as well. So it's a challenge. That's why with the burning damage, not only the physical rehabilitation but also mental health counseling is needed. And the ongoing thing is that the person probably has to deal with the pain feeling. How do you control, do the pain management? And also, if your client or your patient heavily relies on medication, will that gradually develop into addiction issue? So that's something you need to consider as well. And then when we talk about the scar and all that, whether this person will feel like, oh, I don't want to talk to anyone, I don't want to see anyone, and it gradually become socially isolation. Vocational implication, typically speaking, the patient or client that we have seen before, actually with burn injury, typically they are pretty good. The prognosis wise for vocational rehab, they can maintain a good occupational career. It's more of a psychological thing, because most of the clients that we have seen, actually they have continually do the physical rehab, and that significantly expand or increase what they can do. So typically the vocational implication is not as strong as other disabilities, such as multiple sclerosis, which the patient gradually, the functional limitation become more and more serious. But burning injury, actually you can see the prognosis, and typically it's not as unpredictable as other disabilities. So with a good plan, vocational outcome can be pretty bright. So with that will sum up our chapter for burning. So just a little quick memory refresher that so far we talk about the burning and we talk about the statistics. We talk about it's very high in the United States and in the world too. And also we talk about the most common place where people sustain a burning injury is at home, where we feel the most safe and also we feel the most convenient. However, we might overlook something might happen in our house. And also we talk about the type of burning. We talk about whether it's thermal burn, electrical burn, radioactive burning, or chemical burning. It's all different. And we also talk about the severity of burning. We talk about the depth, how deep that burning or fire go into your skin, go into under your skin. Or we talk about the area, so how big that is. And if you guys still remember, we talk about the rule of 9. And also we talk about the adult and kids are different in how to calculate the area of burning. And then we talk about the treatment. So we talk about how to manage the connective tissue, how do you close up the wounded area, and also we talk about the skin grafting. And then we start to talk about the pain management. And then we talk about the how do we manage the scar using the pressure garment. And then we talk about vocational or rehab implication, which we thought for burning client or patient, actually the future is still very bright with following the good plan. And also if you can motivate your client to continue the rehab procedures, usually the vocational or educational outcome is pretty good. So with that, if you have any questions, please send me an email, or you can leave your comments on the discussion board on Canvas. I will try to get back to you as soon as possible. I hope you enjoy this video, and you can replay this video as many times as you want in order to get familiar with the chapter. And I would strongly encourage you guys to look into the chapter on your textbook as well in order to get more detail. Alright, I hope you enjoy it. I'll see you next time. Bye bye.